In our body, there is a chemical, or rather a group of chemicals, called prostaglandins. These are very important chemicals. One of their roles is in inflammation. Now, what is inflammation? For the purpose of this topic, understand it this way. When any tissue of the body is injured, whether due to trauma, disease, or infection, certain changes begin to occur in that tissue and the surrounding area. For example, swelling develops and pain is felt. These changes are called inflammation. In reality, inflammation is the body's response after tissue injury, and its purpose is to take care of the injured tissue. At the beginning, I mentioned that prostaglandins play an important role in the process of inflammation. One of their roles is to make the pain signal carrying nerves around the injured tissue more sensitive so that these nerves send stronger signals to the brain and pain is felt in the injured area. In addition, prostaglandins also play a role in fever, etc. So if the formation of these prostaglandins is stopped, will the pain stop or decrease? Yes. And some medicines actually do this. For example, disprin/aspirin prevents the enzymes that produce prostaglandins from working. As a result, prostaglandins are not formed, and some relief from pain is achieved. The same was thought to be true for paracetamol. However, modern research shows that paracetamol does not work very effectively through this prostaglandin blocking mechanism. Instead, the major effect of paracetamol comes from another mechanism. It acts directly inside the brain on the system that generates the sensation of pain. Throughout our body, there is a network of nerves that serves as a communication system between the brain and the body. When an injury occurs in any part of the body, nerves from that area send signals to the brain, and within the brain there is a system that produces the sensation of pain according to those signals. The paracetamol/Panadol tablet is absorbed from our digestive system into the bloodstream and then reaches the liver, where various chemical reactions are carried out on it by liver enzymes. This happens with almost all medicines. These chemical reactions do not inactivate paracetamol. Instead, they convert it into a more effective chemical called p-aminophenol. This chemical travels through the blood to the brain, where it is converted into another powerful compound called AM404. This AM404 affects the pain system present in the brain in several ways and reduces the sensation of pain. For paracetamol, this effect is much stronger than its prostaglandin-reducing mechanism. In other words, this is the primary and dominant way by which paracetamol relieves pain. So it changes form once after going from the digestive system to the liver, then changes form again after going from the liver to the brain, and through this second form it reduces the sensation of pain in the brain. Paracetamol has been in use since the 19th century, but this AM404-related mechanism was concluded by collectively reviewing various research studies published between 2005 and 2018. Today, pain-relieving medicines consider paracetamol/Panadol to be safer compared to painkillers like disprin. Most likely, further research on how it works is still ongoing. Who knows, this 3 rupee tablet available at ordinary grocery stores may still be hiding a few more secrets within it.